since you are giving few molecules, at least those ones are immediately absorbed. Okay, let's go to the immune system, and we have to 10 minutes, no more, to highlight some concept, to understand how to treat in the right way the inflammatory diseases that are the most hard. Okay, you remember this scheme. Where it is? Okay, CD4, CD8, Th1, Th2. Now, to be super simple, we say this is an immune system in healthy conditions. Th1 and Th2 are in balance. On the opposite, when we are in front of a disease, we have a typical imbalance. If Th2 are upregulated and Th1, Treg downregulated, this is the picture of the immune system of your patient with atopic dermatitis, allergic asthma in general, with atopy. On the other side, when you have the inverse imbalance, Th1, Th17 overexpressed, and Th2, Treg down expressed, this is the typical picture of inflammatory diseases. In this case, I put in this scale also Th17 lymphocytes that are responsible of autoimmune diseases, because I wrote Crohn's, psoriasis, vitiligo, and so on. In allergy, this is the typical, let me see the following one, okay, excuse me, okay. This is the typical picture of an allergic patient. Th1 down, Th2 up is the typical Th1, Th2 switch. Since Th2 are overexpressed, they produce too much of interleukin-4, interleukin-5 especially. 13 is the precursor of 4, so it's not so important. Interleukin-5 overexpressed. I'm stressing you on this concept. Interleukin-5 in the right concentration is a good interleukin. For instance, it is the interleukin able to kill parasites, oxures, the worms. How do you call oxures? Oxuris? Worms. Okay, worms. Okay, worms. For instance, in children, no? There are a lot of species of worms. So usually in pediatrics we observe oxuren infections. So, for instance, in your practice, when you have patient with worms, children especially, you can use with success Guna interleukin-5. But if overexpressed, interleukin-5 is responsible of stimulation of eosinophils. And you know that eosinophils overexpressed are responsible of the chronicity of an allergic disease, especially respiratory asthma. The big bastard in allergy is interleukin-4. Why is really so important? So, Th1 less, Th2 too much, interleukin-4. Interleukin-4, look at the crosstalk, stimulate B lymphocytes to produce IgE. If you are not allergic, that means with interleukin-4 in homeostatic condition, you only produce 2% of IgE. If you are switched Th1, Th2, you produce a lot of interleukin-4, and you have a storm of IgE. IgE go to be adherent to the surface of mast cells or basophils. Second contact with the allergen, degranulation of histamine, and you have the symptomatology. What do you, this is a terrible but interesting picture. What do you use normally in Western conventional medicine for allergy? Antihistaminic, or if you are an allergologist, the specific immune therapy, the allergic vaccine, to desensitize the mast cells. But look, you are working only on the last step of the pathogenesis. I mean, you are working on the symptomatology. You are not working on the real original sin of the allergic patients, that is Th1, Th2 switch. We can work here with the low-dose medicine because we have the words, I love you, that say Th1, please work again, Th2, please take it easy. These two interleukins, I don't know if I have, okay, I will show you later. These two interleukins able to tell Th1 get up and Th2 get down are interleukin 12 and gamma interferon, but we will say after. So you understand that with low-dose medicine, with Guna method, really you can act on the deep etiology of the disease. The opposite of allergy is inflammation. In inflammation, this is the picture. Th1 and Th17 if the etiology is autoimmune, upregulated, Th2 and Treg downregulated. Since Th1 and Th17 are working too much, you can see too much of pro-inflammatory cytokines. After the break, we will study these interleukins, and we will see also the opposite one to control this storm of pro-inflammatory cytokines. In other words, in homeostasis, we have the perfect concentration of all the cytokines. In inflammation, we have an overexpression of Th1, Th17. In immune decline, we have an overexpression of Th2, Treg. In terms of cytokines, in healthy conditions, all the cytokines, the red ones, Th1, Th17, and the blue one, Th2, Treg, are in physiological concentration, and they lead the right function of the immune system. When we are in inflammatory conditions, we have some, especially some of the red cytokines, Th1, Th17, overexpressed, and the blue ones, Th2, Treg, down-regulated. In allergy, is the opposite. These ones are down-regulated, and the blue ones are up-regulated. Our goal will be to reestablish the right homeostasis, the right balance. Is it possible to do this? If diseases are consequences of changing concentration of messenger molecules, is it possible to modulate or to modulate an excess and to sustain a deficiency? Absolutely yes. And on this concept, we establish our therapeutic strategy. We use opposite cytokines, antagonistic cytokines, to induce negative feedback, to slow down a biological effect. Or we use the same cytokine that is in deficiency in that disease to enhance, the biological function. Very interesting is the use of antagonistic cytokine. For instance, for allergy, antagonistic cytokine of interleukin-4. And it is the most modern immunology telling us this is possible. These are some papers, 2006 and 2007, Cook and Bettelli, that spoke in terms of cross-regulation in the immune system. Look, Th1, Th2, they are familiar with you. I stress you enough about that. Th1 produce several interleukins, but two are the most important. And they are interleukin-12 and gamma interferon. Interleukin-12 is able to stimulate Th1. Gamma interferon is able to downregulate Th2. Th2 produces several cytokines, but especially interleukin-4 is so important. Why? It's able to stimulate the production of Th2 and to downregulate Th1. So now I want to ask you a question, just for me to understand if it's clear for you, the concept. In an inflammatory disease, you have overexpressed more Th2 or Th1? Th1. So, to use the concept of cross-regulation, which will be the interleukin able to restore the homeostasis of Th1 overexpressed? Interleukin-4. If you have a patient with atopic dermatitis, are more overexpressed Th1 or Th2? Th2. Which will be, according to the concept of cross-regulation, the interleukins to consider? Interleukin-12 to stimulate Th1 and gamma interferon to downregulate the excess of Th2. Okay, this is the concept, this is a paradigm. This is the concept that we applied for the formulation of the medications. When you will use, for instance, Gunaflam, in the afternoon we will speak about this, Gunaflam, that is our medication for treatment of acute and chronic inflammation. Will you find inside of Gunaflam interleukin-12? No. Gamma interferon? No. Interleukin-4? Maybe yes. Guna allergy prevention of allergy. Will you find interleukin-4? No. Interleukin-12? Yes. Gamma interferon? Yes. So we started studying for years and years the asset of interleukins in all the diseases, and we used in the medications combinations of opposing cytokines to reach what? The homeostasis. Is it clear? Yeah. So, strong on this theoretical part. After lunch, we will start studying how to treat inflammation, how to treat allergic diseases, and many other clinical pictures. Is okay? Perfect. Okay. Now intoxicate yourself with the food.
Just last question. According to that scheme, does it mean that the patient who suffer with chronic disease do not suffer with asthma, and opposite way?
Okay, you can.
Is it clinically proved?
Yeah. Okay.
Did you do that research?
No, right. Very good question. Because in the practice, we observe also patients with allergic asthma and psoriasis. Okay? So it's absolutely true. Look at the very important immune scheme. When you have a patient, both with allergic asthma and with vitiligo, it means that he has an overexpression both of Th2 in comparison with the homeostasis and Th1. Why? Because he has an insufficiency of Treg, so it doesn't work well in terms of immune tolerance. So the approach to these patients with both Th1 and Th2 pathologies is first using TGF-beta, that is the effector of Treg in downregulating both Th1 and Th2, to bring back them to the homeostasis, and then you start treating the most severe disease.
Okay, and do you have the medication of Treg?
Absolutely, yes. It's named Guna TGF-beta.
Oh,
we will study all of these medications in the afternoon. But now, for me, it is important to give you the pillars of the method, because with the method, you will be able to work by yourself. Okay? More than, okay, this is the protocol. No, it's important to deeply understand the concept. Is okay? It's interesting, very interesting, this fact. Sometimes, the most part, you have a classical Th1 or Th2 disease. Okay, perfect. See you in 1 hour, I think.